5 dangerous sleeping mistakes seniors must avoid. Some of them might be silently damaging your heart. Hi, this is Bob, and you're watching The Senior Sage. As we age, our sleep patterns naturally change, but that doesn't mean we should accept poor sleep as normal. In fact, sleep becomes even more important for seniors, helping with memory, healing, energy, and even preventing falls or confusion. But did you know that many seniors are unknowingly making sleep mistakes every night that can harm their health? In this video, we're diving deep into the 5 most dangerous sleeping mistakes seniors must avoid. These mistakes are more common than you think, and fixing them can dramatically improve your sleep, energy, and overall well-being. Stay with us until the end, because mistake number 5 is the one almost everyone overlooks, and it might be silently damaging your heart without you even realizing it. Mistake 1, using a too soft mattress. Let's begin with a common but underestimated mistake: sleeping on a mattress that's too soft. While a soft bed might feel cozy at first, it can spell trouble for aging bodies. As we age, our muscles lose tone and joints become more fragile. A soft mattress doesn't provide the proper support for your spine and hips. This can cause the body to sink, twisting the lower back unnaturally and putting pressure on the neck and shoulders. A poor sleep surface can also increase your chances of waking up with back pain, joint stiffness, or even muscle spasms. Seniors with arthritis or osteoporosis are especially vulnerable. What's worse, sleeping on an unsupportive surface can actually interfere with circulation during the night, making you feel more fatigued in the morning. Many seniors report waking up more tired than when they went to bed. If that sounds familiar, your mattress might be part of the problem. Additionally, improper support can restrict airflow, causing discomfort or even mild breathing issues during sleep. In some cases, this poor sleep posture can aggravate pre-existing conditions such as sciatica or degenerative disc disease. The fix? Choose a medium-firm mattress that balances comfort with support. Look for memory foam or hybrid mattresses designed specifically for pressure relief and spinal alignment. And don't forget your pillow. It should support the natural curve of your neck. For side sleepers, a body pillow can help align your hips and reduce pressure on your knees. Trust me, your back will thank you. Mistake 2, sleeping in a cluttered or unsafe environment. The second mistake is one people rarely associate with sleep quality, but it's crucial: sleeping in a cluttered or unsafe bedroom. Seniors are at increased risk for falls, especially at night. A cluttered room, exposed cords, or poor lighting can turn a midnight bathroom trip into a dangerous accident. Even a single fall can lead to serious consequences: fractures, head injuries, or long hospital stays. It's not just a matter of cleanliness or tidiness. A safe sleep environment directly affects your quality of life and independence. Worse yet, this fear of falling or disorientation can disrupt your sleep even subconsciously. Your brain stays slightly more alert, worrying about hazards. This lowers sleep quality and can leave you groggy or confused the next day. How do you fix this? Make your bedroom a sleep sanctuary. Clear out loose rugs, wires, and obstacles near the bed. Install a soft nightlight that helps you see without straining your eyes. Choose a lamp with a motion sensor or easy reach. Consider adding grab bars near the bed or along the path to the bathroom. Make sure your bed height is appropriate not too low or too high, so you can get in and out comfortably. Keep your essentials within arm's reach: water, glasses, a flashlight, and your phone or emergency alert device. A safe room equals a peaceful night. Mistake 3. Ignoring your sleep schedule. Here's another sneaky mistake: inconsistent sleep schedules. Seniors often think, "I'm retired, I can sleep and wake up whenever I want." While that's technically true, your body's internal clock, called the circadian rhythm, works best on a consistent schedule. Constantly shifting your bedtime or wake-up time confuses your brain, making it harder to fall asleep and stay asleep. Over time, this can lead to chronic insomnia, grogginess, and even depression. Irregular sleep has also been linked to cognitive decline in older adults. That's how serious it can be. Your body needs rhythm, a pattern it can depend on. Disrupting that pattern disrupts hormone production, digestion, and mental clarity. To get back on track, pick a bedtime and wake-up time and stick to them every day, even on weekends. Develop a calming nighttime routine like gentle stretching, reading, or listening to soft music. Avoid screens and bright lights at least an hour before bed. Use warm, dim lighting in your room. Limit daytime naps to 20 minutes and avoid sleeping too late in the day. If you have trouble falling asleep, avoid clock watching. The more you worry about sleep, the harder it becomes. Instead, try progressive muscle relaxation, meditation, or even writing in a gratitude journal before bed. The more regular your schedule, the deeper and more restorative your sleep will become. Mistake 4. Drinking too much fluid at night. Hydration is important at any age, but drinking too much right before bed, that's a recipe for disrupted sleep. Many seniors already struggle with waking up multiple times to use the bathroom. This is known as nocturia, and it's not just annoying, it can be dangerous. Every trip to the bathroom increases the risk of falls, especially if you're sleepy or unbalanced. Frequent waking also breaks your sleep cycles, preventing you from getting into deep sleep stages that restore your brain and body. If you're always tired during the day, this might be the hidden culprit. Plus, getting out of bed multiple times can interrupt your partner's sleep too, leading to frustration and fatigue in the household. Here's what to do. Get most of your fluids earlier in the day. Reduce fluid intake 2 to 3 hours before bedtime. Avoid caffeine and alcohol in the evening. They both irritate the bladder. Alcohol also interferes with REM sleep, which is essential for emotional balance and memory. If you're taking diuretics, ask your doctor if they can be scheduled earlier. In some cases, managing blood sugar levels and diet can also help reduce nighttime urination. Track your patterns in a journal and speak with a healthcare provider if nocturia becomes frequent. Small changes can lead to big improvements in sleep. Mistake 5. Underestimating the link between sleep and heart health. This last mistake is rarely talked about, but it's one of the most dangerous. Underestimating how poor sleep affects your heart. Seniors who suffer from insomnia, frequent waking, or sleep apnea are at a higher risk for high blood pressure, irregular heartbeat, and even heart attacks. When you sleep, your heart rate and blood pressure lower, giving your cardiovascular system a break. If you're not sleeping well, your heart doesn't get that rest, and over time, this adds up. In fact, some studies show that seniors who regularly get less than 6 hours of quality sleep have a significantly higher risk of stroke or heart disease. And here's the really scary part. Sleep apnea, where your breathing repeatedly stops during the night, is often undiagnosed in older adults. If you snore loudly, wake up gasping, or feel exhausted despite sleeping all night, you need to talk to a doctor. You might need a sleep study or even a CPAP machine to protect your heart. Poor sleep also affects inflammation, blood sugar control, and cholesterol, all key factors in heart health. Over time, this can lead to a dangerous cycle. Poor sleep affects your heart, and a weaker heart makes it harder to sleep well. Take your sleep seriously. It's not just about feeling rested. It's about keeping your heart beating strong. Even a small improvement in sleep can result in lower blood pressure and improved heart rhythm. So there you have it. Let's recap. 1. Sleeping on a too soft bed. 2. A cluttered, unsafe sleep environment. 3. Inconsistent sleep schedule. 4. Too many fluids before bed. 5. Ignoring the link between sleep and heart health. If you're making even one of these mistakes, don't panic. It's never too late to make a change. Improving your sleep can improve every part of your life. Better energy, sharper memory, fewer aches, and even a longer, healthier life. Here are a few bonus tips to round things off. Keep your bedroom cool and quiet. A room temperature between 60 to 67 degrees Fahrenheit is ideal for sleep. Consider white noise machines or earplugs if you live in a noisy area. Use blackout curtains to block street lights or early morning sun. If you suffer from anxiety or overthinking at night, try writing down your worries earlier in the evening to clear your mind. Now, here's a challenge. Pick one of these mistakes that you know you're making and drop it in the comments right now. Let us know what you're going to fix starting tonight. Your decision might inspire someone else to take action too. If you found this video helpful, please like, comment, and subscribe. Sleep well, and we'll see you in the next video. This is Bob, and you love the Senior Sage.